NAMI Tennessee at home live. We are super excited to be here. And before we get to our super awesome guest, I want to remind everybody that NAMI Tennessee has an email list that is absolutely free. You can sign up right there at namitn.org, and it tells you all of the things that NAMI Tennessee is doing. The things like, well, this, and things like the gala, and things like the walk, and most importantly, legislative advocacy that you can participate in absolutely free. It comes out about once a week. It's a super cool email. I swear I don't get a toaster if you sign up. I just think that it is a really cool thing to keep in touch with what NAMI Tennessee is doing all across the state of Tennessee. All right, well, that's enough of that. Let's bring on our super cool guest, Sara. Welcome to the show. Can you introduce yourself?
Yes. Hey, thanks, Gabe. I'm Sara. I am super excited to join you guys today. Little bit of background about me. I've got a master's in clinical psychology. I'm a licensed professional counselor in the state of Tennessee with specialization with mental health services. Non-professionally, I live in Nashville, lived here for about 10 years now with my husband and 2 dogs. We are actually about to open up the house to some foster dogs as well. So excited about that. And what else? I love gardening. You can see my plants behind me. Rock climbing is a big passion of mine.
Oh, wow.
Happy to be here.
That is awesome. I didn't mean to interrupt. We don't normally get rock climbers on the show. Now, when you say climbing rocks, like you mean like what we see on TV where you screw the thing into the rock face and you're climbing up and you've got have you climbed Everest?
I have not climbed Everest. No, and that is not on the to-do list at all. Way too cold. But yeah, it's a super fun sport. So definitely recommend to anyone trying to find something adventurous to do for sure.
Well, that is very, very cool. Well, thank you so much for being here and for introducing yourself. Now, of course, we're here to talk about Tennessee Health Link, and the name of the program is What is Tennessee Health Link? So it just seemed only appropriate that was the first question that I asked you. Sara, what is the Tennessee Health Link program?
Yeah, okay. So Tennessee Health Link is essentially it's a care coordination program. So it was launched in 2016. By the Division of TennCare. For those of you who aren't familiar, TennCare is the state of Tennessee's Medicaid program. And I'm actually the Tennessee Health Link program manager at the Division of TennCare. So we launched in 2016. We serve children, adolescents, adults. The goal of our program is to provide care coordination for behavioral health, but also physical health. So it's a behavioral health program. But there's a big emphasis on coordinating with physical health providers as well to improve outcomes, for Tennesseans living in Tennessee. So I mentioned it's Medicaid. So that means that all the members who are in the program currently have Medicaid insurance.
Sara, thank you so much. I don't want to fall into the weeds, but you mentioned 2016. Obviously, this had to get started somewhere. And I'm just curious, what are the origins of the Tennessee Health Link program? How did it come about? Why was the need seen? And how did it get started? Usually things like this don't just pop up overnight. They have a lot of foresight and planning involved.
Yes, definitely, Gabe. And I'm going to try to not get too much in the weeds. I could probably talk for way too long about this, and it would probably be kind of boring. But so in 2016, TennCare received what's called a SIM grant. And that's the funding that started with Tennessee Health Link. I think that funding ended about 2017 or 18. We were able to show positive outcomes with Tennessee Health Link. And so that funding, we were able to receive further funding from the state when that grant ended. Now, TennCare, it's really exciting. I'm going to nerd out a little bit, but Tennessee is kind of at the forefront of this transformation in the way that we pay for healthcare. So the goal of Tennessee Health Link, there's some other programs that fall into this as well, but is to really transform how we pay for healthcare, going from what's called just a basic fee-for-service model. Now that's just kind of paying based on volume. So somebody, receives a service and you get this set fee. What Tennessee Health Link is a part of is paying for quality rather than just volume of services. So a really cool element of the program for providers is if they are showing that they're really helping Tennesseans. They've got good outcomes with their members. They're actually eligible for bonus money at the end of the year. So it's a really exciting time, honestly, for Tennessee, because different states in the country are starting to move for this paying for quality rather than just numbers. But it's not something that's super widespread yet. And Tennessee is really taking a leadership role in that. So exciting, super awesome.
That is awesome, and that's incredible. Thank you so much for sharing that. So we understand what it is, we understand where it came from, but now let's get into sort of the nitty gritty. What services do the Tennessee HealthLink organizations provide?
Yeah, so, and I mentioned it's a care coordination program. So the point of the Tennessee HealthLink program is for care coordinators to be able to help members receive the care that they need and hopefully reduce barriers to getting that care. So let me back up a little bit. And you guys might hear me saying members. If I'm talking about members, that's the same as clients who are receiving Tennessee HealthLink services. We just refer to members in terms of at TennCare, we refer to people who have Medicaid as members. So if you hear me say that, same thing as clients. But anyways, so the care coordinators are able to really assess, what is this client needing today? What services are they needing and how can I help them reach those needs? So the cool thing about it is providers have a lot of flexibility with this program. So let's say a care coordinator is working with somebody who has a bipolar diagnosis. They also have diabetes. They can look and see, hey, I see they're picking up their bipolar medications and it looks like the symptoms are going well, but they haven't had follow-up with that specialized provider for their diabetes. Let me jump in, let me give them a call and see what I can do to facilitate that. So it really depends on what the needs of the client are. Transportation, a lot of time, is a huge barrier for getting services for clients. So care coordinators are able to help assess that. Sometimes it's housing. There might be, housing issues, and they can help with that as well. Getting medications a lot of times can be a problem as well. And we know, when there's disruption in medication, that is just that can open a whole, door of issues, obviously. So that's another service that they could help with. I would also say that our care coordinators do a lot of work with the families as well. So, and support persons. So I actually, in looking at notes from a care coordinator recently, they mentioned NAMI. There was a family support program that NAMI was offering that they were helping that parent get involved with. So yeah, it really depends on the need of the person, but it's care coordination services.
A lot of times we hear the phrase wraparound services or case management services, or is it, I don't want to put words in your mouth, but it sort of sounds like that to me, like to make sure that we're not just, here's your medication and then we abandon you when people don't have stable shelter or they don't have transportation, et cetera. So is coordination of care, wraparound services, are these, am I describing, do these all mean essentially the same thing?
Yeah, and I would say that's a great question, Gabe. I would say, yes, wraparound services are ensuring that all of the different needs are being met. So like physical health, behavioral health, your social determinants of health. So like housing, access to clean water, food, things like that. Care coordinators absolutely play a big role in ensuring that those clients are getting those wraparound services and helping to reduce barriers to getting those services.
Very, very cool. So now, of course, now people are listening like, okay, this is incredible. I love this. How do I get involved? How do people enter the Tennessee HealthLink program?
Yeah. Okay. So I'm going to two-part answer here. One, entering from a provider standpoint. And let me just speak a little bit about our providers. They're community mental health providers in the state of Tennessee. We're across the state. Gabe, if you could even name one, I'm sure they're probably a Tennessee HealthLink provider. So Gabe, where are you from? Do you live here in Nashville or?
I live in Central Ohio. My family is from Memphis. So I've got a huge contingent of people in the Tennessee area, or the Memphis area of Tennessee.
Okay. Gotcha. So yeah, in Memphis, we've got like Alliance Behavioral Health. They're a big hitter out there. Middle Tennessee, I think most everyone in Tennessee is familiar with Centerstone Mental Health Cooperative. These are all Tennessee HealthLink providers. We also have smaller providers, but across the state. So for those providers to become a Tennessee Health Link, let's say they're interested, they're providing mental health services, interested in becoming a provider in the Tennessee Health Link program, they would reach out to their managed care organizations. So in Tennessee, our managed care organizations these are our Medicaid insurance providers. That's Blue Care, AmeriGroup, and United Healthcare Community Plan. So anyone on the call is familiar with those. That's who you would reach out to your representative to see if you're eligible to become a HealthLink provider. Now, as far as a member or a client becoming a HealthLink provider, there's 3 different ways that members enter the program. The first is diagnosis only. So there are what a lot of times you see in research, they'll refer to it as severe and persistent mental illness. Generally, that is going to be schizophrenia-related disorders, bipolar disorder and related disorders, and major depressive disorder. For the criteria for diagnosis only, if somebody has schizophrenia or related disorder, bipolar disorder or related disorder, or they have a recent history of homicidal thoughts or suicide attempt or self-harming, they're automatically eligible to the program. Now, that doesn't mean that they're automatically placed. Of course, we want the participants in the program to want to be in the program, right? That's important buy-in. So, you would, if you talk to a provider and, thought that would be a good match for you, that would be a way to enter the program. The second way that participants enter the program is through a combination of diagnoses and what we call level of care stays. So if somebody has essentially any mental health diagnoses and went to a hospital for their behavioral health needs, so that could be maybe they went to an ER, or maybe they went to an inpatient psychiatric hospital, or any hospitalization, they are eligible for the HealthLink program. And then the final category that gets you into the program is a provider you're working with is already a Tennessee HealthLink provider, and they identify that, hey, this person really could benefit from the program. So if you're in a community mental health center in Tennessee and you are interested in the program, you could talk with your provider there and say, hey, I heard about this, curious if this would be a good fit for me. Examples of that would be, like, let's say maybe somebody is really struggling with their mental health. They don't have that schizophrenia or bipolar diagnosis, and they haven't been hospitalized. Maybe they're not at that point yet. Sometimes we'd like to get that service in place before hospitalization is necessary. But they've got a functional need for the program, meaning like they're isolating from friends or family, or just having a really hard time taking care of their physical health. The provider could then enroll them in the program.
Very, very cool. Now, a question came in from the audience. We take anonymous questions. I probably should have told you that ahead of time. I promise it's not a gotcha question. But one of the questions came in is, with the rise of this program, did other programs go away? Did they use the word traditional case management, and I assume they just mean the case management that existed before this program. Did we lose any services? Is this in addition to those services? What's the landscape look like now that Tennessee HealthLink is here?
Sure, yeah. So Tennessee HealthLink replaced level 2 case management. The biggest change actually was more flexibility for providers when Tennessee HealthLink was implemented. The reimbursement rates, part of us changing over was that the providers would not have any decrease in the amount of money they were receiving. And then also now have an ability to actually earn more money, bonus money. I kind of alluded to that a little bit earlier. But yes, it did replace what formerly was known as level 2 case management in Tennessee.
Perfect.
But
Thank you.
As far as the services that were provided, it's kind of enhanced services that now are provided through THL.
Well, and this leads me right into my next question, because obviously whenever you hear that something goes away or that it replaced something, people are like, well, isn't that bad? Didn't we need that? Isn't it a good thing? So I fit the question right in there on purpose, because have there been any outcome studies on the Tennessee Mental Health Link program, and what are the findings? How is this program doing?
Yeah, excellent. So there was an analytics report done in 2019. So we launched in the end of 2016. So it was on the first 2 years of performance. And there's actually some really cool, encouraging results so far. First, they found that they've seen improvements in quality, particularly physical health. And I'll speak on this just a little bit. When we're talking about individuals with severe and persistent mental illness, unfortunately, and this is something that's really sad and something that really has driven an emphasis on this physical health, life expectancy for folks with severe and persistent mental illness, research is indicating it's anywhere from 10 to 20 years less than the general population. Now, and I think that some people, when they hear that, they think, well, yeah, it could be related to their it's related to their mental illness. Maybe there's higher suicide rates. And yes, that's part of the story, but it's definitely not the whole picture or even the majority of the picture. Really what research is showing, it's more physical health issues that are accounting for that shorter life expectancy. So there's a lot of comorbid physical health problems like cardiovascular, respiratory issues, infectious disease issues. And it can be, part of it is when you're suffering with, severe mental health symptomologies, it can be hard to take care of your physical health. And then we also know that medications like antipsychotics, there are unfortunately some side effects with physical health issues as well. So that's why a big drive of this program is to keep an eye on those physical health concerns. One of the things that we track is people with bipolar disorder who have diabetes. Are they getting the care that they need? Another one that we're tracking closely is children and adolescents on antipsychotic medications. And are they getting that metabolic monitoring? Are we making sure that physically they're doing okay? So I feel like I got a little off track there. Oh, outcomes. That's what I was talking about. So what we've seen is there has been improvements, particularly in physical health outcomes. Something else that's really cool is we've noticed less inpatient admissions and ER visits. There's also been greater follow-up with primary care participants. And I want to just say that this analytics report is on Tennessee.gov. I think if you Google primary care information, you can get to that link quickly. I can definitely share it. But that report is published, ready to read. Now, we'll say this. We had started on another analytics report. However, COVID happened, right? So it's kind of hard to look at outcomes when you're dealing with the pandemic because, for example, we did see even greater decrease in ER visits, but that could be people just not going to the hospital for behavioral health reasons is what I mean. But that could be because people were, staying home more. So we are waiting for a little bit more post-pandemic before we complete another analytics report. But yeah, the initial one was very, very promising.
This is one of these, I'm just curious, you mentioned the pandemic and obviously this started a couple of years or about 4 years before the pandemic, give or take, right? You said 2016 is when it started, pandemic, roughly 2020, or the beginning of 2020. Do you feel that this program helped in that situation? I know with the rise of telehealth and obviously you mentioned paying attention to physical health and mental health together rather than separated. Do you feel that people in Tennessee were better off because this program existed when the pandemic hit? Because I know it's kind of a convoluted question, but different states handled the pandemic very differently when it came to mental health. And a lot of states, while they all have, boards and mental health departments, et cetera, not everybody is as inclusive as Tennessee. Like you said, they're leading the way. Mm-hmm. Was this pivot a protective factor? The fact that this existed, do you think that it helped people with mental illness? What did you see? And I know that some of this is largely observational. You didn't do a study. I'm just curious, was this a protective factor for folks in Tennessee that this existed when the pandemic hit?
Yeah, I mean, I think having that engagement with providers certainly was helpful. Now, we did have to move to complete telehealth for a while, of course, with in the heart of the pandemic. I will say one of the silver linings, I like to say silver linings of COVID, because there were some, and one of the silver linings of COVID for Tennessee HealthLink, we did allow, initially their first visit had to be in person. And of course, with the pandemic, we had to adjust, and just like everyone had to adjust their practices, they were able to do that telehealth. What I'm hearing from providers is that really has helped with engagement. So there's some participants who in the program who, maybe they're just not so sure. Do I really want to get in? This seems like it's going to be too involved. I'm going to have, someone interfering with life, and just, I don't know if I need that level of care. But they'd agree to a phone call. They'll agree to an initial phone call. And because they were able to do that telehealth rather than being forced to come into the visit, they got that buy-in. So I do think that there were some silver linings with that. I do think that from talking with providers, for some people, their care coordinators, that telehealth visit, that was their human interaction, their human, engagement. So, yeah.
The rise of telehealth has been amazing, and it's. I'm trying to make this nice, but it's fascinating. The mental health community knew the benefits of telehealth long before COVID, and we just got a lot of pushback that it was unsafe, it wouldn't work, it was dangerous. It just every excuse under the sun as to why we couldn't do this because it was bad. And then, of course, the whole world needed it because of the quarantine, and suddenly it's available. So I just want to ask a quick follow-up on that. You mentioned the silver lining of the pandemic. Are you seeing that telehealth, and I know you just gave but can you expand on that? Is this here to stay? Is telehealth a good thing? Has it been proven? Are you a promoter of it? What are you seeing with telehealth in terms of treating people with mental illness?
It's so funny that you asked that, because we just, in a meeting I was leading last week with our managed care organizations, we were having this discussion. And it's something that we certainly at TennCare are going to continue to have internal discussions about. I do know more of the research on the therapy side of things is indicating that, and even for group therapy, there was an article I was reading recently that outcomes are similar to in-person. And it does for some people who are not able to get in person. Maybe they're working, or they're a primary caregiver for people at home. It reduces barriers to getting treatment. So that's huge. What I will say is I don't think there is as much literature specifically on care coordination telehealth. And is that as effective as it would be in person versus telehealth? So that is actually something we are going to be doing on our end, a lot of research on, to kind of better understand that, and really let the research drive, any programmatic decisions we make with HealthLink being telehealth versus in person.
I like that research is ongoing, and I like that we're looking into it. And I agree with I say that the silver lining to the pandemic is the rise of telehealth and the open discussions surrounding mental health. Of course, we need to have equivalent open discussions about mental illness, right? We don't want to, but we're getting there. We're getting there, right? Just I don't want to insult one thing because we're not getting another one, but just everybody listening, yes, we're having way more conversations about mental health, but we need way more conversations around mental illness. But I do see us getting there. So, back on track. How many organizations are part of THL, and how many Tennesseans are served? And is THL available all across the state?
Yep, it is. We are in East, Middle, and West Tennessee. We currently have 18 organizations across the state. Many of our organizations are not just in one region. They've got locations kind of in different regions. Right now, we're at last count, and I think that would be September is my last data on active participants. But as of that time, we had about 90,000 Tennesseans that we're currently serving with Tennessee HealthLink, which is just amazing. We've got more adults than kids. So over 18, there's about, I think it's like 50, upper 50,000s, and then kids is more about 30. So we count that as 18 or under 18 is our kid and adolescent population.
That's beautiful. Yeah. That's beautiful. And it's ongoing, and you're learning more and more and more every day. So more people are being served as the program grows and people find out about it. Of course, anything that's statewide is always fantastic. I've hosted this show for almost 2.5 years now, and I talk to so many people, and it seems like it's like, oh, we really love serving the people of Tennessee as long as they live in Nashville or Memphis. And I'm
right.
like, this is a big state. What about everybody else? So I'm glad that you have such wide reach. I think that is absolutely incredible. My next question is, are there any resources Tennessee HealthLink providers have access to that other organizations do not?
Yeah, that's a great question. So we have specialized trainings that we provide to the providers. We actually last week just had a collaborative put on by United Healthcare in Memphis, actually, on suicide assessment and crisis intervention. And that was excellent, especially given I learned during that collaborative that suicide is the highest rate in Shelby County across Tennessee. So definitely we're happy to work with providers. We actually had Tennessee HealthLink providers come to that collaborative and worked with them on that. That was awesome. So besides specialized trainings, things like that, we also have what's called the care coordination tool. So it's a web-based application that THL providers have access to. It's basically information center. Providers do it differently. They have flexibility. Sometimes they'll have an administrator that is the only person that has access, and sometimes they'll have all their care coordinators be able to access the tool. But there's a lot of good information on there. They can see how they're doing overall in terms of their performance in the program. They also can drill down to specific clients. So, for example, care coordinator Courtney could get on and say, okay, I'm seeing, here are my 5 clients I'm seeing today. Let me check and see how they're doing. And maybe see, oh, Joey, he looks like he's compliant with his medications, but he hasn't had metabolic monitoring and he's taking this antipsychotic medication. So let me make sure that I'm getting that appointment. I talked to him about it today and make sure that gets signed up. So that's really cool. There's also a hospitalization feed that they can have access to. All the hospitals in Tennessee have, it's called I'm going to forget what it's called right now, but it's, an ADT feed. So they track admissions to hospitals, transfers to other hospitals, and discharges. The care coordinators can actually see when their members have been hospitalized and discharged. That way they can make sure they follow up and ensure that they're getting, the appropriate follow-up care they need after hospitalization. And this could be physical health, reason for hospitalization, or it could also be a behavioral health. So if they went into an inpatient psych hospital. So that's been something that I know a lot of providers have found super helpful as well.
Awesome. Sara, I know we're getting near the end of our time together, but I have to ask, how did you become the program manager for the Tennessee HealthLink program? We've talked all about Tennessee HealthLink. What's your story? What's your involvement? Why are you passionate about this? And you're clearly passionate about it. How did you end up here?
Yeah, how did I end up here? I will tell you this, I would not have expected to at all. If you had asked me 3 years ago, there's no way I would have told you I was going to be going into state government, more policy side. But it kind of comes from my background. Prior to taking this job as Tennessee HealthLink program manager, I had only done direct client care jobs, specifically in higher levels of care. So I've worked residential treatment for child and adolescents with trauma, and then a lot of experience in inpatient psychiatric hospitalization. And while I found that work very rewarding, and it was so cool to see people, be able to come in and really not be feeling good, and then when they leave, they're feeling, really well and helpful. It also was very overwhelming to see kind of these people who were in and out of the hospital. And I thought there just has to be more we can doing on a community level, because while if you need inpatient hospitalization, if you need residential treatment, truly, that's great. It really can be a matter of life and death. However, if anyone's been hospitalized or worked on that side of care, we know that it also can be very traumatizing. It can be very interfering with life as well, and also for your loved ones. So I'm really passionate about people being able to get the care that they need while they're home, and hopefully being able, whenever possible, to receive care at home, whether that home be a group home or you're living with your family, or, wherever you are. We need folks to have the services that they need and not be in this revolving door of higher levels of care, because it really can interfere with happiness, and living your best life. So that's kind of what brought me to this. Is it was all the experience in high level care, I'd said, you know what, I want to go opposite side and really work on amping up outpatient care and making sure people are getting what they need.
Sara, that's awesome. And obviously we're glad you're here. This is the section of the show where is there anything, it's the final thought section. It's really where you get to ask yourself a question and answer it. Is there anything else that you want to explain? Anything that I didn't ask? Anything that you want to expand on? You have an unlimited amount of time to do so. We just want to make sure that the audience knows everything that Sara has to share.
Well, I would say the one thing that we didn't really get into that's a big part of the program is engaging our care coordinators, engaging members who perhaps are hard to engage. You know, there's some people that we work with severe and persistent mental illnesses that really have a hard time, you know, connecting to others. They're afraid to come into the hospital. They're afraid to get the care that they need, afraid to go to the community mental health center. So, and that is associated with severe and persistent mental illness. I mean, a lot of times there's a great deal of isolation. So a big part of the program is outreach to those individuals. If you see that, you know, there's been somebody who has been hospitalized, you know, 6 times in the last year for their bipolar disorder diagnoses, but they're not seeing a therapist, they're not seeing their doctor, our care coordinators, the focus is, and different, they get creative, different means possible. Hey, let me reach out, let you know we're here to help. We want to help, you know, make sure that your needs are met. So yeah, that would be one other thing, a big part of the program that we didn't quite touch on today, but wanted to plug that as well.
That is wonderful. Sara, thank you so much. How can folks find it? Not necessarily you in particular, but find the program. What's the website? What's the information? Where can folks go?
So if they just Google Tennessee Health Link, it's going to pop up. We're part of TennCare, so that's a government agency. We're on the Tennessee.gov website. But yeah, if you just Google Tennessee Health Link, our page will be right there. And then there's also contact information as well.
That is awesome. I literally just popped on the screen, Google Tennessee Health Link. It will pop up. I also put it in the comments section. We would put the link up, but it's a government link, so it has a lot of random letters, characters, numbers. It's not just something easy like GabeHoward.com or something like that. In fact, I will put it up here just so people know I'm not lying.
There it is, yeah.
Yeah, there it is on the screen. I also put it in the chat as well. Sara, sincerely, thank you so much for spending the time with us. We really, really appreciate it. I sincerely can't thank you enough.
Yeah, thank you for talking with me. This is fun.
Oh, well, you are very, very welcome. All right, everybody. This is the part of the show where I remind you again to sign up for NAMI's Tennessee's email list. I always like to pretend that I froze right there. I don't know why. Please join NAMI Tennessee's email list at namitn.org. It's how you can find out about great things like this. You would have missed it if you weren't on the list or you didn't stumble upon us on Facebook. You can also find out all about legislative advocacy and how you can get involved and help yourself, your loved ones, the people of Tennessee, everybody benefit from that advocacy work because we need people. So just head over to namitn.org and sign up. Thank you so much for being here, and we will see you next time on NAMI Tennessee at Home Live. Big wave.